The Minister of Health is warning Kenyans to prepare for tough times ahead as it announced that the country was staring at a second wave of the deadly COVID-19 disease. The ministry pointing a finger at politicians and social places for making a mockery of the containment measures, leading to a surge in cases of coronavirus. On a day, the country recorded 685 new cases from 4,912 samples. It's back to the drawing board for Kenya in the fight against the deadly COVID-19 disease, as the Minister of Health on Sunday announced a second wave of the coronavirus infection in the country.
On October 1st, it was 4%. A day later, on October 2nd, it rose to 7%. On October 3rd, it went to 8%. And it has been, in the period since, marked a consistent upward trajectory. Today, at about 13% incline and a daily rise in deaths, we can confidently point to a potential crisis unless we take some immediate actions to avert this.
The Minister of Health says the reckless behavior by Kenyans, including politicians, has catalyzed a spike in infections witnessed in the past few days, as it announced 685 new cases of the coronavirus tested from 4,912 samples, indicating a 13.9% positivity rate compared to the 4% positivity rate before COVID-19 restrictions were lifted.
It is indeed true that the younger people are the ones who are taking the greatest risks with this disease and flirting with it. This is not a problem for the youth as such. We are seeing a return to normalcy even amongst health workers. These times are not normal, and please do not treat them normally.
According to Health Cabinet Secretary Mutahi Kagwe, counties such as Nakuru, Kilifi, Turkana, Kisii and Bungoma that had initially shown decline in numbers are witnessing a surge of cases.
The spike we are witnessing has not just erupted out of nowhere. It has in part been triggered by wanton violations of containment protocols and advice from our experts. I am told that bars are neither requiring their patrons to observe social distancing nor asking them to wear masks, and they seem to be under the impression that sanitization at the door is a sufficient requirement for service.
Kagwe warning that the nation was facing a rough time with ICU cases on the rise, with currently 28 patients in critical care, 10 on ventilators. According to the ministry, the country's health system is almost strained, with 1,000 people in various hospitals struggling with the COVID-19 infection. The new trend alarming, with the ministry saying even people with no underlying conditions now succumbing to the disease. From the new cases, Nairobi County tops the list with 141 cases, followed by Nakuru with 127. Mombasa has 73 cases, Trans Nzoia 61, Kisii 37, Kiambu 30, Kakamega and Kisumu 27 cases each, Busia 20, Kilifi and Nandi 18 cases each, Nyeri and Turkana 14 cases each, Nyamira 10, Kajiado and Taita Taveta 9 cases each, Bungoma 8, Uasin Gishu, Laikipia and Machakos 6 cases each, Baringo 5, Muranga, Meru and Wajir 3 cases each, Kitui, Kwale and Makueni 2 cases each, while Siaya, Elgeyo Marakwet, Vihiga and Isiolo counties single cases. 7 more people succumbed to the disease, taking the fatality number to 832. To contain the spread of the disease, the National Emergency Response Committee on COVID-19 advises counties to enforce the existing containment measures, warning if Kenyans continue to behave normally, it will be forced to reinforce strict measures.
If we lose this individual responsibility that we're supposed to have, then we go back to a situation where it's now between health and the economy. And health will always be the one that takes preference. So mine is really to urge Kenyans, please take personal responsibility for yourself and for those around you. Take care of the country.